This video is about downregulation and what that means. And so if a person has graduated, they're going to be taking the medication in perpetuity for a number of months going forward and maybe forever. And so we don't want the nerve to get too used to what's going on. So this is called downregulation. And so we try to stick to 4 rules going forward in treatment to prevent downregulation from ever happening, so we never have to worry about it. So there's 4 methods. Number 1, make sure there's CBD in the medication. And so we start out with that process, but later when somebody graduates, they may have different products that have less CBD. But if you make sure there's some CBD in there once in a while, it's enough to confuse the nerve. So that's number 1. Number 2 is don't use more than 10 milligrams at a time. Now, it's not wrong to do more than 10 milligrams at a time, but more than 10 is a little heavy for the nerve, and it will start squishing the receptors down. It's too heavy. It's kind of like seagrass. You step on it, it's too heavy. You squish it all down to the ocean floor and the beach. It takes a little time with tides and winds and weather to increase the seagrass. Those are receptors on the nerve, essentially. So greater than 10 milligrams can be a little too heavy, not just once, but repetitively beyond that, then yes. That's number 2. Number 3 is don't do more than 30 to 40 milligrams in a 24-hour period. And in our program, we choose to limit it less than 40, and we kind of strategize on the patient if they have low risk or moderate risk or high risk of downregulation. So really the higher amount of milligrams you do in 24-hour periods, you have higher risk of downregulation. So not more than 30 to 40 milligrams in an entire 24-hour period. And that's not just once, that's like repetitively doing it. Lastly, it's a good practice as number 4 to prevent downregulation from happening in the first place. Take a break from cannabis, okay? Once per week or once every 2 weeks, you take a solid day off of all cannabis products. That means no products whatsoever, no CBD, THC in your daytime. We always encourage you still take a night dose the night before and the night after, because you really have to capture that sleep and that good sleep architecture. But if you take a break in the day, you follow the rules, you have CBD in there, you don't do more than 10 milligrams per dose, and you don't do more than 30, 40 milligrams in a day, you're likely to do very well in this program going forward in perpetuity. Any questions, always, please reach out, and we're happy to have further discussion and further education. Nice to chat again.